Acute appendicitis is the inflammation of the appendix, and the most common site of the appendicitis is the retrocecal. And most common cause of appendicitis is the fecolith obstruction due to constipation caused by the decreased fiber in diet and increased carbohydrate. The acute appendicitis is the most common cause of acute abdomen in the young patient. And the clinical feature of the appendicitis are the migratory right iliac fossa pain and nausea, vomiting, and patient came with the fever and anorexia, and the mental score is for the presentation of the acute appendicitis. It includes the M for the migratory right iliac fossa pain, A for anorexia, and N for nausea, vomiting, T for tenderness, and R for rebound tenderness, and E for elevated temperature, and L for leukocytosis. And leukocytosis count is around the 11,000 to 14,000 cubic millimeter. And as for the shift for neutrophil to the left side. And total score for the mental score is the total is 10, and if the more than 7 score, it indicate the acute appendicitis. And for clinical examination, we will use McBurney point where the patient feel the pain, and McBurney point is the site medial 2/3 and lateral 1/3 of the line joining the umbilicus to the anterior superior spine. And acute appendicitis is a clinical diagnosis. Generally diagnosis do not require, but if required, the best investigation is the CCT. And USG done for the rule out differential diagnosis like ectopic pregnancy in the teenage. And the management of the appendicitis is the mild appendicitis we will manage conservatively with antibiotic, and in severe we will do appendectomy. And for appendectomy there are the two type of the incision. One is the muscle splitting incision, and second is the muscle cutting incision. Most commonly used is the muscle splitting incision. In muscle splitting incision there is the McBurney technique which is most commonly used, and in muscle cutting incision there is the when we will extend medially, then we call the Fowler technique, and when we extend laterally then we call the Rutherford Morrison technique.